Welcome back to the Deep Dive, your health bulletin. So lately, it feels like one health recommendation just dominates almost every conversation, doesn't it?
You mean the steps?
Exactly. The 10,000 steps a day goal, we see it absolutely everywhere, on our watches and articles. It's almost presented like this universal truth or being active.
It really is. It's become so ingrained.
But have you ever stopped to really wonder where that specific number, 10,000, actually came from? And maybe more importantly, is it truly applicable to everyone everywhere?
That's such a vital question to kick us off because, while a lot of the studies backing these step counts come from places like the UK, Norway, Australia,
Yeah.
places with, let's face it, pretty different environments and infrastructure.
Right. Often higher standards of living, maybe cleaner air generally.
Exactly. So it really makes us ask, can we just directly apply those findings to countries facing vastly different realities? Think about somewhere like India, for example. The air quality you might be breathing while you walk, the safety of the water you drink, the pesticides potentially on your food, even just the safety of the roads. It's a completely different health landscape.
It really is. So our mission today is sort of twofold. First, we want to unpack what the science actually says about physical activity, about step counts.
Get beyond the marketing hype.
Precisely. And then second, we need to critically examine these other crucial, often overlooked environmental factors, especially in contexts like India. We're talking air quality, water contamination, pesticide exposure, road safety, things that profoundly impact your overall well-being, sometimes no matter how many steps you manage to get in.
Yeah, it's a much bigger picture.
Definitely. And we've pulled from a pretty diverse stack of sources for this deep dive: systematic reviews on exercise and pollution, case studies on water quality in eastern India, pesticide effects in southern India, broad reports on road safety. Lots to get into.
Okay, let's dive in. So starting with that 10,000 step idea, it's fascinating, isn't it, how fixed that number seems?
It really is. It's gospel.
But what often surprises people is learning that the whole 10,000 steps a day thing, it isn't actually rooted in scientific research initially. Not at all.
Really? So where did it come from?
It originated from a Japanese pedometer marketing campaign back in the 1960s. Seriously.
A marketing campaign.
Yeah. They called their device Manpokai, which literally translates to 10,000 step meter. It was catchy, it stuck.
Wow. So a marketing slogan became global health advice.
Yeah.
That's quite something. My fitness tracker is basically a 60s ad campaign on my wrist.
Sort of, yeah. But okay, if 10,000 isn't this magic number derived from science, what does modern research actually tell us about effective step counts for health benefit?
Right. What's the real story?
Well, recent large-scale studies, and these involve researchers from places like Sydney, the UK, Spain, Norway, they've shown pretty significant health benefits with actually far fewer steps than 10,000.
Okay. How many fewer?
For adults, getting as few as 7,000 steps a day seems to substantially reduce the risk of major issues like heart disease, dementia, and even early death.
Just 7,000. That's a really powerful finding.
Yeah.
Fewer steps, but still getting those major benefits.
Exactly.
So does that mean there's a point where, more isn't necessarily better? Do the benefits level off?
That's precisely what the research seems to indicate. There's often a plateau effect somewhere around that 7,000 to 10,000 step mark.
A plateau. Okay.
Meaning, for many people, pushing way beyond that, say 12,000 or 15,000 steps, might not actually offer significant additional health benefits. It's about finding that effective range.
Right, the sweet spot. And I guess this varies by age, too. What's the advice for older adults compared to, say, kids?
Absolutely, it's tailored. For older adults, maybe over 65, the recommendation is typically a bit lower, maybe 4,000 to 7,000 to 7,500 steps daily.
And the focus changes slightly there, I imagine.
It does. It shifts more towards maintaining mobility and, really importantly, preventing falls. Even just a consistent 20 to 30-minute walk each day can be incredibly effective for balance, strength, and keeping independence.
That makes sense. And for children and teenagers.
They need more movement. Research links higher step counts for them, like 12,000 to 16,000 steps a day, to better body weight and heart health. So much more active.
This brings up a crucial point, though. It's not just how many steps.
Yeah.
The quality, the intensity must matter too.
Oh, definitely. Experts really stress this. The intensity of your walk can actually matter more than just hitting a certain number.
So like strolling versus power walking.
Exactly. For cardiovascular benefits, the ideal is generally a brisk pace, where you're breathing faster, maybe can feel your heart rate go up, but you could still hold a conversation if you needed to.
Moderate intensity.
That's the one. That kind of moderate intensity is what really gives you those deeper heart health benefits.
And of course, it's important to remember flexibility and making it personal, especially if someone has existing health conditions.
It's absolutely crucial. For people with pre-existing conditions or maybe recovering from something, walking goals need to be highly personalized. Often the advice is just start small, maybe 10, 15 minutes a day, and build up gradually.
And talk to your doctor, presumably.
Always, always consult with a doctor. The main thing is consistent movement, trying to avoid long stretches of just setting and really listening to your body to avoid injury.
Okay, so we've kind of debunked the 10K myth and got a clear picture on steps. But this is where I think our deep dive gets really interesting.
Yeah, the context matters.
Hugely. If a lot of these studies come from the UK, Norway, Australia, we have to ask, what happens when the environment itself throws up major health challenges?
Yeah.
Does just hitting 7,000 steps matter as much if the context is completely different, like in India?
That's the critical question. And these issues are so tangled up. Take air pollution and exercise. Our sources highlight something pretty stark.
Which is?
That exposure to air pollution when you're doing endurance activities, think cycling outdoors, running it can significantly affect your cardiopulmonary health, your heart and lungs.
So you're trying to do something healthy.
And the air itself might be working against you. Pollutants from traffic, especially the particulate matter, PM2.5, PM10, plus things like nitrogen dioxide, ozone, they're linked to inflammation and potentially reduced lung function.
Wow. What sort of effects are actually seen, like physiologically?
Studies have observed changes in things like heart rate, blood pressure, and forced vital capacity. That's basically how much air you can forcefully breathe out. And these changes can happen even after relatively short exposures, sometimes just 60 minutes.
Just an hour, that's quick.
It can be. But there's nuance here, too. It's important to say that not every study found significant negative effects on lung function.
Oh, why the difference?
Well, it suggests other factors are at play. Things like how intense the exercise is, how long you're out there, your individual fitness level, maybe even some adaptation if you're chronically exposed. It's complex.
Okay, so it's not a simple A plus B, C. That nuance is important.
Yeah.
So for people trying to stay active in polluted cities, are there ways to, like, reduce the risk? Mitigation strategies?
Yes, definitely. Things like choosing routes away from heavy traffic, if possible. Maybe exercising at times of day when air quality tends to be better, like early morning or after rain.
Or maybe incorporating indoor workouts.
Exactly. Indoor training on really bad air days is a key strategy. Some people explore particulate filtering masks too, though their effectiveness during intense exercise is still being studied properly.
And stepping back, looking at the bigger picture, this really highlights the need for systemic changes, right? Like cleaner energy sources for homes.
Absolutely. Cleaner household energy in low resource settings is huge. And promoting active transport walking, cycling that itself can help reduce vehicle pollution if the infrastructure supports it safely. It's potentially a win-win.
But air isn't the only environmental factor. Let's shift to water quality. You mentioned a specific case study from Eastern India.
Yes, access to safe drinking water is just fundamental, and waterborne diseases are a massive public health issue and an economic drain globally.
I can imagine.
The sources we looked at included a study from Khurda in Odisha and Paschim Medinipur in West Bengal. Millions globally suffer from water-related illnesses, diarrhea, vomiting, stomach pain, fever, and diarrhea is tragically a leading cause of death for children under 5 in India.
That's incredibly sobering. We often assume piped water equals safe water, but this study had some quite surprising findings about that, didn't it?
It really did. Counterintuitively, they found that 17% of households surveyed who had piped water reported someone being ill recently from water issues, compared to only about 5% with non-piped sources.
15% with pipes. Why?
Well, people reported issues like a foul smell from the water, sometimes reddish water indicating iron, problems with faulty pipes, leakages, and just generally irregular supply. Plus, rapid urbanization and poor waste disposal often contaminate the groundwater sources that feed these systems.
So the infrastructure might exist, but the quality control or the system integrity can be a huge issue. What about people treating their water at home?
That's another major gap identified. A really significant proportion of households in these areas don't treat their drinking water before they use it. In Odisha, it was around 45% in urban areas, over 66% in rural areas, and even higher in West Bengal, particularly in rural parts.
Wow. So many people drinking untreated water, even from potentially compromised piped systems.
Exactly, and that obviously contributes heavily to the disease burden.
And this isn't just about health, is it? There's a real economic cost, especially for poorer families.
A huge one. The study calculated an average household cost per illness episode at about 48 rupees, which is roughly, say, 60 US cents.
Doesn't sound like a lot, maybe, at first glance.
But here's the devastating part. For the poorest households, that amount can represent a massive chunk, sometimes even more than their entire daily income. Imagine losing a whole day's earnings or more just because the water made you sick. It's a hidden economic crisis.
That really puts it into perspective. It's crippling. So what did the study find were the main drivers of illness, and what helps prevent it?
Things like noticing a foul smell from the pipeline significantly increase the odds of illness. On the flip side, factors like higher income, higher education levels, and having access to proper piped sewage systems were all linked with households being more likely to use water purification methods, boiling, filtering, etc.
So better infrastructure and awareness helps.
Definitely. It shows that improving the water supply quality and treatment practices doesn't just reduce illness and the economic burden. It can also improve hygiene, how food is prepared, overall well-being, potentially freeing up resources and time for other economic activities.
It's also interconnected. We've touched on air, water.
Right.
What about agriculture? Pesticide exposure is a big concern in India's huge farming sector.
That's right. Agriculture is massive for India's economy, about a third of the output, employing maybe two-thirds of the workforce. But, and this is critical, around 99% of these workers are in the unorganized sector.
Meaning less protection, less access to healthcare.
Exactly. Limited access to healthcare, social security, making them really vulnerable. And pesticide use is widespread. Tamil Nadu, for instance, uses something like 12,500 metric tons a year. It's the highest in India.
That's enormous quantity. What are the health impacts on the people actually spraying these chemicals day in, day out?
There was a study focused specifically on professional pesticide sprayers in southern India. The findings were pretty stark. Compared to people in other jobs, these sprayers had significantly higher rates. We're talking 3 to 6 times higher odds of things like breathlessness,
Wow.
chronic cough and phlegm, symptoms of peripheral sensory neuropathy that's like tingling, numbness, pain in hands and feet, and recurrent stomach issues like abdominal pain, nausea, vomiting.
That's a heavy toll.
Yeah.
How do the pesticides actually cause this harm?
Well, they're volatile. They easily become aerosols when sprayed. So inhalation is a major route. They can irritate and damage airways, the lungs, and then their skin contact. They can cause local irritation, but because many are lipophilic fat-loving, they can also be absorbed through the skin into the bloodstream.
And are there longer-term risks beyond those immediate symptoms, more systemic problems?
Yes, there's concern and some evidence for that. Studies, including one done in Hyderabad, have found potential for genetic damage, actual DNA damage in people exposed. There's also some indication of links to abnormal glucose regulation, potentially increasing diabetes risk among factory workers dealing with pesticides.
It seems obvious that protective gear, PPE, would be vital. Did the study find that using PPE made a clear difference?
It's crucial, yes, but the findings were a bit mixed. Using PPE didn't consistently reduce all the reported symptoms in the study group. However, there was one key area where it clearly helped: peripheral neuropathy. Non-users of PPE had a significantly higher risk of those nerve symptoms.
So it offers some protection, but maybe not complete? Or perhaps compliance is an issue?
Could be a mix of factors: type of PPE, how consistently it's used, the specific chemicals. But it highlights that PPE alone might not be the whole solution. Reducing overall exposure is key.
Okay, one last major environmental factor impacting activity and health: road safety. This is a global issue, but it has a huge local impact, especially for people trying to walk or cycle.
Absolutely huge. Globally, road traffic crashes kill around 1.3 million people every year. It's staggering. And over 90% of those deaths happen in low and middle income countries.
1.3 million, that's a public health crisis level.
It really is. And the burden falls disproportionately on vulnerable road users. That's pedestrians, cyclists, motorcyclists. They make up more than half of all road traffic deaths and injuries worldwide.
And cities seem particularly dangerous.
Yes, estimates suggest 40–50% of all road fatalities happen in urban areas. Often, unplanned or rapid urban growth leads to road environments that are just inherently hazardous, especially if you're not in a car.
So what's the way forward? How do we make walking and cycling safer, more viable options, especially in these challenging city environments?
It requires a really integrated approach. It's not just about transport planning. It has to involve urban design, public health perspectives, law enforcement, even getting the media involved in awareness.
The systems approach.
Exactly. There's the safe systems approach, which originated in places like the Netherlands and Sweden. The core idea is to design the entire road system, roads, vehicles, speeds, user behavior, so that even when crashes inevitably happen, the forces involved don't result in death or serious injury. It accepts human error, but tries to make the system forgiving.
So fundamentally redesigning cities away from being just car-friendly.
Precisely. There's a definite shift happening, or needing to happen, towards transforming cities that prioritize vehicle flow into places designed for people, enhancing livability.
What does that look like on the ground?
Better street design, for starters. Things like wider sidewalks, protected bike lanes, safer crossings, traffic calming measures. Also, promoting more compact city structures where daily needs are within walking or cycling distance.
This has knock-on health benefits beyond just crash reduction, right?
Yeah, absolutely. Making walking and cycling safe and appealing encourages more people to do it, which reduces reliance on private cars, cutting pollution and congestion, and directly helps combat non-communicable diseases linked to inactivity, like heart disease and diabetes. It's a systemic approach to creating healthier environments and healthier people.
Okay, so we've covered a lot of ground. We started with that ubiquitous 10,000 steps number. Saw it was more marketing than science.
Right, debunked that a bit.
Explored the real science, showing benefits, starting around maybe 7,000 steps, with intensity mattering. But then we really dove into these critical environmental factors: air pollution, water contamination, pesticides, road safety, particularly thinking about a context like India.
Yeah, layers of complexity beyond just individual activity levels.
So bringing this all together, what's the key takeaway for you, the listener, when you hear health advice, especially about something like physical activity?
I think it boils down to this crucial understanding. Yes, physical activity is vital, hugely important, but achieving overall health and well-being it's a multifaceted challenge. Simply hitting a certain step count doesn't happen in a vacuum.
It doesn't magically cancel out other risks.
Exactly. It doesn't negate the impact of breathing polluted air day after day, or drinking unsafe water, or being exposed to harmful chemicals, or navigating dangerous streets just to get around. Those environmental realities are powerful shapers of health.
And this is where, hopefully, your aha moment comes in. Understanding this broader context means you can interpret health advice with more depth, more critical thinking.
Yeah, it empowers you.
It empowers you to ask better, more informed questions, not just about your own habits, but about public health policies, about the environment you live in, about the infrastructure provided. It shifts the focus, doesn't it, from being purely about individual responsibility
To recognizing it's a shared responsibility, including the need for systemic environmental and infrastructural improvements to support everyone's health. Our individual health journeys are just deeply, deeply intertwined with the environments we live in.
Couldn't agree more. So to leave you with a final thought to mull over, something to maybe explore further on your own, how do we both as individuals trying to reach our personal health goals, maybe tracking our steps, and also as a global community, how do we balance that personal pursuit with the really urgent systemic need to address these broader environmental and infrastructural realities? Realities that profoundly shape well-being, especially in diverse communities all around the world.
That's the big question, isn't it? Something to think about long after you've stopped walking for the day.